There's certainly no evidence that serotonin or any other particular biological process that people have pinpointed so far has a causal role in depression. There was a big campaign in the 1990s called the Defeat Depression Campaign, which was aimed mainly at GPs to persuade them to diagnose more depression and prescribe more antidepressants. There was no association between the serotonin gene and depression, and no interaction between the gene, adverse life events and depression, but that there was an association between adverse life events and depression.
Now then, welcome to Reconnect, the podcast for people who want to heal and grow from life's tough times. I'm Joe Tudor, the founder of the Reconnect Club and a mental health keynote speaker. Today I'm chatting with Joanna Moncrieff, a professor at University College London and a consultant psychiatrist for the NHS. Joanna is one of the world's leading experts on the influence of serotonin on depression. We'll be talking about where the chemical imbalance theory came from, what the science actually says, and what might be causing our depression. Right, here's Joanna.
Could you explain what serotonin is and what do we know about it?
So the short answer is not very much.
Wow.
But we haven't been honest about that. We, the academic community and the professional community, have been giving people the wrong impression and pretending that we know more than we do for a long time. So since at least the 1990s, when there were these big marketing campaigns to promote the new antidepressants, the SSRIs, people have been given this message that depression is caused by a chemical imbalance, particularly a deficiency of serotonin. Serotonin is a chemical that's found all over the body, including in the brain. Most of it's actually in the gut, and quite a bit of it is in the blood cells, but some of it is also in the brain. And in the brain, along with lots of other chemicals, it helps to transmit the electrical impulses from one nerve cell to another. So it's what we call a neurotransmitter. But beyond that, we don't understand very much about what it does exactly. And this idea that it is involved in mood, emotion, memory, cognitive activity actually is not well supported by evidence. And then, of course, there's this idea that it's the cause of depression, that the idea that you were told that, that the depression is caused by low serotonin, you're not making enough serotonin in your brain. This is an idea that's been around a long time, that was, as I said, put across by the pharmaceutical industry and supported by lots of professional organisations, but has never had good evidence to back it up.
It just seems in society that it's just accepted and people think it's known that serotonin is almost a happy chemical, is how I thought of it. And I just thought really simply, didn't have enough of this happy chemical and I needed more of it. And that was the cause of my depression. Yeah. And I find it quite shocking as well to hear that it started with a marketing campaign. Could you share a bit more of the history as to how this message that I was told by my GP has become so widespread?
Yeah, I will do, but I just want to emphasise what you say about it being shocking. And I think part of what you're saying is you're shocked to know that actually there's never been any good evidence to support this theory. And although lots of doctors have been putting across this idea and telling patients you've got a serotonin imbalance, actually it's been known in the medical and academic community for a long time that the evidence didn't really stack up, that it was pretty weak and inconsistent at best. And yet that academic and research community has allowed doctors to go on telling patients and allowed the media to go on telling the public that depression is caused by a chemical imbalance or a serotonin deficiency. So that is a shocking situation, and I think it's one that we need to reflect on seriously as a profession and as a society. How did it happen that people were misled about this very important subject for so long? So how did it start? Well, the idea that depression is caused by an abnormality of some certain brain chemicals goes back to the 1960s. That was a time when the psychiatric profession were starting to see themselves more and more as akin to other medical doctors, and some new drugs, that some of which had some beneficial effects, were being introduced into psychiatry. And so some certain doctors started to develop these theories about the chemical origins of some psychological problems, including depression. So one theory was that depression was caused by a lack of noradrenaline in the brain. That's another brain chemical. And another theory was that it was caused by a lack of serotonin in the brain. And those ideas were around, but it was acknowledged that they weren't really supported. They were just theories until the late 1980s. And then the pharmaceutical industry got hold of them when they were promoting the SSRIs that were first introduced in the late 1980s, and really ran with that message. They took those theories and they presented them as if they were not theories, but as if they were facts. They just bombarded the public with the idea that depression was caused by a serotonin imbalance, a serotonin abnormality, or an abnormality of some other combination of brain chemicals. And they repeated it again and again. Sometimes they said, depression may be caused by a serotonin imbalance. Sometimes they said it is. But the fact that they repeated this message so many times meant that people came to believe that it was true. And I think a lot of doctors came to believe it was true as well, actually, even though, as I say, if you actually read the small print of medical textbooks in detail, you will see that it is acknowledged that actually the evidence is very weak and inconsistent. That's
the impression I got from my doctor. Like, she really believed what she was telling me, and it came from a good place. So again, shocking is the right word to use. I think it's shocking to hear that just normal people like me are being told that there's something wrong with us on the back of a theory and a big marketing campaign.
So there was a big campaign in the 1990s called the Defeat Depression campaign, which was aimed mainly at GPs to persuade them to diagnose more depression and prescribe more antidepressants. And it also, part of it was also aimed at the general public to break down people's caution about taking drug treatment for depression or for emotional problems. The context of this is that during the 1980s, it had become apparent that there was a huge problem with benzodiazepine dependence. These benzodiazepines, drugs like Valium and Librium, had been doled out by the bucket load, essentially, to people who were unhappy with their lives for one reason or another, often to women. And initially they were presented as being non-addictive, that there weren't any problems with dependence. And then it became clear in the 1980s that actually they were just as addictive as the barbiturates and all the drugs that had gone before them, and that there were a huge number of people who were physically dependent on these substances and struggling to get off them. And so the pharmaceutical industry, so people became worried about the idea of taking drugs to deal with emotional problems, and the pharmaceutical industry had to overcome that reticence and that reaction to benzodiazepine use. And so they launched these campaigns in collaboration with parts of the medical profession to persuade people that there was nothing wrong with taking a drug for your depression if it was an antidepressant, and that antidepressants weren't addictive. Although we now know that although people don't misuse them, they do cause physical dependence and can be very difficult for some people to get off, especially if they've been on them for a long time.
Wow. So it sounds like this theory was presented. People were critical of it all the way throughout, but in 2022, I think, you led what seems to be the most recent and largest review of the evidence into this chemical imbalance, into serotonin theory. For those listening that aren't academic like myself, could you please explain what an umbrella review is? And secondly, what did you find in your serotonin review?
Yes, I will do. But just let me say again why I did it. So I knew that I knew that most academics or people who knew about the research were aware that the evidence for the serotonin theory of depression was inconsistent, but there was no paper that put all that evidence together and that you could point to say, look, this shows that the serotonin theory of depression isn't supported. And I also knew that a lot of the general public thought that this wasn't a theory. They thought it was a proven fact. As you're saying, you know, that's how it was conveyed to you, that this was a proven fact. So I thought it was really important that there was a paper somewhere that was published that got the evidence together and showed how weak and inconsistent it really was. So we did what's called an umbrella review, and that means that we looked at it. An umbrella review is basically a review of previous reviews. And we did this because there is so much research out there on serotonin. There are thousands and thousands of studies. And so what we did is we took the main areas of research and we looked at all the recent reviews on those main areas of research and put them together in one paper, and then were able to come to a conclusion about the overall state of the evidence. So just to give an example, there is research on levels of serotonin in various body fluids such as blood and the brain fluid that is called the cerebrospinal fluid that surrounds the brain and the spinal cord. And various studies have looked at whether there are differences in levels of serotonin or serotonin breakdown products in those fluids in people with depression compared to people who don't have depression. And so we looked at the reviews of those studies and found that they weren't actually showing any difference in people who had depression and people who didn't have depression. And then there were various other areas of research, and we applied the same principles and looked at all of them. There are an area of research that's quoted quite often concerns a strange set of studies where they give people who don't have depression, they're called healthy volunteers, this drink which lowers their blood concentrations of a chemical called tryptophan, which is the molecule that serotonin is made out of. And the theory is that if you lower people's tryptophan, they will therefore have less serotonin circulating in their brain, and you should therefore be able to induce depressive symptoms in people who've had this drink, this procedure.
I'm smiling just because I'd heard that, and I heard that if you have a hot cup of milk, it can increase tryptophan, which makes you happier. And I'm just smiling because now you explain that. I was like, I've done that at points. So sorry, I've cut you off there. Please carry on.
So these drinks are quite unpleasant, apparently. So that might make you feel bad. But what they were doing was comparing a drink that had all these amino acids, but not tryptophan in, with a drink that had all the amino acids, including tryptophan. And they were trying to compare whether the drink that lacked tryptophan caused depression compared to the other drink that had tryptophan in. And anyway, thousands of these studies have been done, and they do not find that there's any difference between people who have the drink lacking tryptophan and people who have the drink with tryptophan in people who don't have depression. There were one or two studies conducted a while ago that suggested there might be some difference in people who already had depression, most of whom had been treated with antidepressants. So maybe there'd been some changes in their serotonin system produced by the antidepressants. But actually, the numbers were very small. Again, the results were highly inconsistent, and the more recent studies that we found on this didn't show a difference in patients either.
So you looked at several different areas of how serotonin could impact depression. So you're really extensive. Yeah.
And then, so basically over all the areas, there was no evidence that low serotonin in particular is associated with depression. There was some slightly strange evidence from one or two areas which suggested that possibly higher serotonin might be associated with depression, But I think if those results are correct, it was probably an antidepressant effect that we were seeing rather than an effect of depression, because most of the people in all these studies were taking antidepressants. But there was another area we looked at that was interesting. So we looked at the genetic studies that have investigated whether people who have a gene that a certain form of the gene that produces the serotonin transporter. Now, the serotonin transporter is a molecule that removes serotonin from the gap between the nerve cells where it's active, and it's actually what SSRI antidepressants target. And they target this transporter and reduce its efficiency, and the idea is that thereby increases the amount of serotonin that's available to be active in the gap between the nerves to transmit impulses. Anyway, there are some genetic studies that have looked at the gene for the transporter, and these again show no difference between people with depression and people without depression. But the interesting thing about these studies is that there was an idea early on that there might be an interaction between the gene and adverse life events. And what the studies show is that actually there was no interaction, but that adverse life events did have a very profound effect on depression, even though the genes didn't have an effect. But the other thing that these studies show that was interesting and has a bearing on all the rest of the research is that the bigger and better studies found no effect. So early on, there was some smaller studies that weren't conducted as well, lower quality studies that did. Some of those suggested some effects of the gene or some effects of the interaction between the gene and the adverse life events. But the bigger and better studies which involved hundreds of thousands of people, because there are these huge genetic data banks now, were absolutely conclusive that there was no association between the serotonin gene and depression, and no interaction between the gene, adverse life events and depression, but that there was an association between adverse life events and depression.
That's so interesting, because it's something I saw in my own research, and I hear a lot of the time people that are experiencing depression that would say, my parents had it, my grandparents had it, and it's genetic. So the latest credible research suggests that, you still hear it in TED Talks and books, like that genetics has a role to play in depression, but the latest research says that there's...
So this is not about the genetics of depression. This is about the genetics of the serotonin transporter gene. So it specifically relates to the serotonin theory of depression. So there's no evidence that there's any difference in the genetics of your serotonin system. That doesn't mean that there might not be some genetic component to depression. I would say that there probably is some, but I'm not sure that it's specific for depression. There's probably some genetic component to your personality, and that is going to influence how you respond to the events in your life and whether you're more susceptible to depression than other people. So I think there probably is some small genetic component, although most studies suggest that environmental components, how you're brought up, and the things that happen to you during your life are more important.
Right, okay, so I follow. So it was just specifically within the genetic impact of serotonin you researched. Yeah. So when you publish this research, my experience was it sent shockwaves throughout the world. I was sent your research from 3 different continents, and I've been saying this from the start, and I think you absolutely did what you set out to do, which was you put it all together under one review that people could relate to. What evidence has been presented to you that might suggest you were wrong?
So the initial reaction to the paper was really interesting, and mostly consisted of psychiatrists coming out and saying, "Oh, we knew that all along. It's not important." Yeah, of course. There's no evidence that serotonin causes depression, But the important thing, they said, is that antidepressants work. It doesn't matter how they work, but they work. And so basically they were telling people, don't take any notice of this research. It doesn't matter. Just keep taking the tablets. That is not how people saw it. people, as you have explained, had been told that the reason they should take these tablets is because they had a chemical deficiency in their brain. Well, if that's not substantiated, then why are they taking these tablets and what exactly are they doing? So those were the questions that people were asking me. And at the same time, psychiatrists were saying, no, those questions aren't important. Just keep on taking the tablets. So that was the initial reaction. Then several months later, people started to write letters into the journal, and some of them suggested that there was some evidence that serotonin was involved in depression. And they quoted all sorts of complex, indirect evidence, which suggested possibly, if you took a very generous view of the evidence, there might be some role for depression, for serotonin in depression, but they didn't. None of them offered any specific or testable hypotheses. They were saying things like, well, serotonin's involved in the inflammatory process and neurocircuitry and this and that process, and we think these are all relevant to depression, therefore serotonin must have a role in depression. It was almost like they were saying, well, there's a lot of serotonin in the brain, and we know the brain, you have to have a brain to be depressed, therefore serotonin must be involved in depression. That was basically the argument they were making. Some people offered some other evidence. For example, there are some curious studies that have given people, that have involved giving volunteers, people who don't have depression, SSRI antidepressants, and then measuring their response to various expressions of emotion. So basically they're shown a face of a complete stranger, a random person who's got a happy expression, and then they're shown one who's got a angry expression and shown one that has a sad expression. And these experiments were set up to test whether antidepressants affect what they called emotional processing. People's, and by this they meant people's ability to correctly or incorrectly identify these emotional expressions. And because some of these experiments were reported as showing some effects of antidepressants on emotional processing, it was concluded, because most of these antidepressants affect serotonin, that therefore serotonin must have some role in depression or the sort of processes that lead up to depression. Once again, if you look at those experiments in detail, they are completely inconsistent and almost certainly show nothing at all. Although there was an early experiment that showed that people who'd taken antidepressants were less likely to recognise anxious faces, there were another 2 experiments with the same antidepressant that showed they were more likely to recognise anxious expressions. So in fact, the results were completely inconsistent and don't support the point that the people who are putting them forward were making. Even if they did, it was a very indirect argument.
So you've put the research out there, quite clearly shown there's no science behind it, and it sounds like people have been clutching at straws to prove that serotonin is influencing depression.
Yeah, absolutely. Clutching at straws, I think puts it very well. The other tactic that people came up with was to immediately move the goalposts and say, "Oh no, it's not serotonin; it's something else. It's neurodegeneration, or it's inflammation, or it's another brain chemical, maybe glutamate." Then quoting a whole load of research that supposedly again supported these theories. And I've had to say many times when people have asked me about whether there are other possible biological causes of depression, there are lots and lots of other theories out there, dozens at least of theories about the possible biological causes of depression. None of them are any better supported than the serotonin theory of depression, which is not supported by the evidence.
Wow.
I was going to say, when we were talking about the depression campaigns earlier, that one of the motivations of those campaigns to try and be generous, I mean, one of the motivations was the pharmaceutical industry were giving the medical profession a lot of money, but to try and be generous, one of the motivations was to try and break down stigma. And it was perceived that if you think of something as a medical condition and as having a biological cause, then that will be less stigmatizing. Now, telling someone that their feelings and their behavior is down to a particular brain chemical abnormality, rather than part of their personality, part of their and connected with their agency, may help in the way that it relieves people from responsibility. It probably has an initial effect of making people feel a bit of relief and less guilt, and less inclination to blame themselves. But actually, it's been shown, first of all, that the idea that mental health problems have biological causes is more stigmatizing. People are more likely to say they don't want to live next door to you if you have a biological problem with your brain than if it's said that you have a problem that relates to your childhood or things that are going on in your environment. People are more likely to distance themselves if they think something has a biological as opposed to a social or psychological cause. And secondly, the research shows that people who think that their difficulties are due to a specific brain chemical abnormality have a much more pessimistic view of their outcome and possible prospects for recovery than people who see their difficulties as something that is a reaction to, and a potentially understandable reaction to, their circumstances, or past or present.
That's what I experienced. So I remember sitting in my GP's chair and feeling conflicted. It was like a completely different feeling in my head and my stomach. On the one hand, intellectually, I wanted to take what my GP was saying, and I did. She'd given me a reason for why I felt depressed, and it was a simple reason that all I had to do was follow her advice. It was almost like I passed over control to her. She had a medication, and she put me on a waiting list for therapy as well, so that needs to be added. But she gave me this explanation as to why I felt depressed, but something in my stomach told me that I think at the time I felt it like it was cheap. It was like a quick fix that I was suspect of. But I took it. I went away and I spoke to very few people because, exactly as you said, I felt a stigma. I felt like there was something wrong with me. I felt like I had an inferior brain to the other people in the room because there was something broken with it. And I wasn't going to shout about that. I wanted to keep it quiet and hide it. But I've been told I have this medical problem, so I wanted to confide in a few people. I'm literally talking 3 or 4 people that I told. And the message was reinforced that I had a chemical imbalance. They didn't want me to suffer. They wanted me to go down the medical route because I was in pain and they thought that would get me out of pain. But after about 2 weeks, I got a slight boost. I'm talking for no more than 2 weeks because I left feeling like I can do something about this. My GP has my back and I'm going to roll with it. But then it got worse. It didn't go away. I felt even worse. And every time I went back, my GP just increased the dose. And every time she increased the dose, I felt like a bit inside of me, but my hope just got chipped away until I had no hope at all because the medical route wasn't working for me.
Yeah. So there's a lot of interest at the moment in what has been branded treatment-resistant depression, and that's because various new drugs are being marketed and licensed for this condition, and that basically means depression that hasn't responded to a couple of short courses of antidepressants. And this very concept does exactly what you're saying. It essentially blames the patient or makes the patient feel that there's something wrong with them, that they haven't responded to this treatment. And so you end up with patients who are in a very vulnerable, distressed state, and we're now bringing out some potentially quite dangerous drugs for people in this condition, including esketamine, which is a variant of ketamine. Psychedelics are being suggested for this situation. There are opiate-related drugs and benzodiazepine-related drugs, and I think it's a really worrying, and it is exploiting that desperation that is induced by being told this is your brain that's at fault.
Right. Okay.
Just to clarify. Of course, when we feel anything, when we do anything, there are chemical reactions taking place in our brain. So when we're depressed, there will be brain chemical events going on, activity going on. But that's different from saying that the depression is caused by a specific chemical reaction or deficiency or process. And not only did we, and there's no evidence at all that there's any abnormality in serotonin or any other biological process that precedes depression in a way that might be acting as a cause of depression in that way. There's not, as our reviews show, there's not even any evidence that there's any abnormality in people who are depressed. So there's not even any evidence that serotonin might be part and parcel of what's going on when you are depressed. But there's certainly no evidence that serotonin or any other particular biological process that people have pinpointed so far has a causal role in depression.
What impacts this had on your work?
So after the serotonin paper was published, I got lots of emails, and there were also articles published by people who had really deeply absorbed this idea that they had a chemical problem in their brain, and that had become part of their identity, and they were really upset by finding out that that this whole idea was based on no good scientific evidence, and that must impact people's experience in therapy and people's ability to unpick what exactly has been going on in their life that's led them to where they are and what they need to change, because it seemed to be such a deeply ingrained part of people's identity. Some people rose to that challenge and said, right, okay, I've been lied to. I'm getting off this medication. I'm going to take a different route. But many people were very upset by it, and really just didn't want to hear it, wanted to block it out. And it's completely understandable. But I just think it just shows how, some people who were in your position really deeply absorbed this idea that there was something defective about them. And I'm sure that will have had profound consequences for their subsequent life.
There's two sides to this. So as I got a short bounce, but then it made me feel really worse. And I can see anyone who has gone down that route, and doctors as well, it must be scary. It must be scary to think, actually, what I've been told isn't backed up by scientific evidence. But if anyone's listening to this and they do feel scared of that and they do feel uncomfortable, perhaps they're directing some anger at us, I'd say what I experienced was the most important part of my mental health journey when I came across work such as both of yours, was that I regained sense of hope. That's the thing I am the most passionate about. From seeing past this medical view, I regained a sense of hope. Now, it's not an easy path. I'm still working on it now, but hope for your future, I think, is so important. So if we move on from the chemical imbalance and the medical argument, we've discussed that. If depression isn't a chemical imbalance, then what is it?
I think it's useful to think of depression as a type of emotional response. I mean, we call it a mood. A mood is, you can talk of a mood as being a sort of sustained emotional response. But emotional responses are, by their definition, reactions to things that happen in our life. And I think that depression is, by and large, a reaction to circumstances. And I think it's useful for people to understand it like that.
The one thing I've struggled with is sometimes I just find myself going 3 or 4 days where I'm feeling really rubbish, and I was like, wow, I feel really depressed. And I don't know why. And you're right, it has taken work for me to go back and look and be like, well, what's gone on that's led to this? Because you don't always know.
So sometimes it's not until quite a long time after the event that people realise what it was that had actually led them to feel depressed. It may take a bit of time and perspective.
Yeah. There's a book I'm probably going to reference throughout, besides your amazing work, called The Myth of Normal, but by Gabor Mate. And he explained it really well. He used an analogy of, he said, depression is like being in a swimming pool with a beach ball. So you think these really difficult life events happen. Some of them could be in childhood. Some of them could be really traumatic, and you've just completely blocked them out. You cut yourself off from that emotion, and cutting yourself off from that emotion is like having a beach ball in a swimming pool, where you've got to push really hard to keep it down, and it's always trying to pop back up. Yeah. I thought that was a really...
I think one of the problems with how we see depression now is that we see it as a thing that people have, so as if it's its own thing, and that, of course, has been reinforced by taking this medical view, and, you know, with the idea that someone comes in and the doctor gives you a diagnosis, so they uncover that you have this thing in your body, this depression, and that means we're sort of regarding it as if it's the same thing in every person, which of course it's not. It is, you know, if we think of it as an emotional reaction, then we can acknowledge that it is an emotional reaction in an individual, and will necessarily be coloured by that individual's experience and personality and everything. And it will always be you, and therefore will require a unique response. So you can't just say, this is the treatment for depression. That's a meaningless thing to say, I think, in my view.
We look at so many reasons as to why we might be depressed. Some are practical in our life. We look at the bigger picture, which we should do. But I think this gets missed off. And some of the ACEs, the adverse childhood events, are more common than you think.
Absolutely.
I did a piece of research myself. It's not academic. It was me just trying to test what other people thought. And I asked people a question: what caused your depression? And 1,282 people responded to this question. Childhood trauma. It's about a bit of an explanation. It was an open text box. They could write whatever they wanted. I've then gone through and kind of created categories and added a tag. So the most commonly cited issue as to why people felt like they were depressed were issues in childhood. The next was bereavement. Then it was work issues, family issues, relationship changes and abuse. So specifically on adverse childhoods, I was really shocked at the amount of people that had experienced physical, emotional, or sexual abuse. And that really took me back. And the other thing that is classed as an adverse childhood event is parent separation. And I don't think that gets talked about enough. And I think probably from a good place, because we don't want to criticise single parents. I was raised by one, and they're amazing. And But one of the issues I've found is that apparently 23% of families with children in the UK are headed by a single parent. And that's a really hard job.
Absolutely.
And so many, so many couples break up. So so many children will experience that issue, and it's never easy. It may be common, it doesn't mean it's easy. Another thing I'd like to add to that list, because I see it a lot in people I see, especially young people I see nowadays in clinical practice, is both insecurity and difficulty finding direction in life and meaning in life. So, that a lot of young people are caught in this trap of it's really difficult to find a job that will pay enough money to pay rent, to move out of the family home. So you sort of can't get on with your life, and you're trying to find something that will pay enough money, you can't necessarily explore and find what it is that you want to do and that will actually give you some satisfaction.
It's so important. If I'm just summarise, because one question I'm often asked, and I hear a lot, is like, why isn't there one simple answer? And we've explored it throughout the last few minutes, but just to summarise, that we all have different childhoods, we all lead different lives, no two experiences are the same. And if depression is a reaction to the life events going on around us, then no two cases no two experiences of depression are going to be the same.
Yeah. And no two solutions are going to be the same, because the solution has to be trying to address the life circumstances that are making people unhappy. It might also be about addressing, or processing some childhood trauma or experiences. But often there are current circumstances that are contributing, and so they need to be addressed, and the solution to that depends on what those circumstances are. Whether it's, if someone's in a job that's making them feel awful, or in a relationship that's going wrong, those two situations require different sorts of solutions.
And I think that ties into what you were saying earlier about the treatment-resistant depression view, because I sometimes hear there's people that have tried everything, as I had at the start, and people have been really brave and they've been like, I want to do something about this. And sometimes a view that like it's antidepressants or therapy, they're the only two things, and if you've done those, then there's nothing else that can be done. But what I've experienced, I'm a little bit nervous to talk about this, but I kind of went to therapy years ago and unpacked why I might feel the way I do. I've taken practical steps, made life choices. Exactly, you said, I've really was fortunate that at that time in my life I was able to pursue changing career, doing something that I really felt was meaningful to me. But I've had cases where I've started to feel depressed again. And what I've come to learn is I'd done some of the work, and some of the work was understanding why might I feel this way, unpacking it with a therapist and making practical changes. But I've come to unthread all of that and learn that actually on the back of those events that have happened, I've created not a very nice view of myself. Like, I think a lot of people like me that have experienced depression feel a lot of shame, and that comes to play later in life. And I just thought I'd share that.
I think what you said about liking yourself is so important. I think if we don't like ourselves, we will be susceptible to depression. And I think if we can come to like ourselves, that's one of the best protections and one of the best treatments. And how do we come to like ourselves? That's complicated. And again, that's going to be different for different people. But I think one of the problems in the world at the moment is first of all, there's a lot of meaningless work out there. One way that people come to like themselves is they feel they're doing a valuable job that contributes to society. And another thing is the breakdown of community. The other thing was that, we used to live in smaller communities where we'd have a role in that community, and that would make us feel important and valued. And, that's not possible for many people nowadays, or more difficult to find. It's not impossible at all, but more difficult to find.
I want to come back to that actually, because you said something that, and I'm glad it's not just me, I think shame and not feeling good about yourself is really common, especially with people experiencing depression. And I like how you described it, just I might not like myself. What events have gone on in your life that might have, especially when you were younger, that might have led you to a position where you don't feel like you're good enough, where you don't like yourself. And I think the stuff I read in the survey and from what you've spoken about, I can understand why people might feel that way. I really can.
And it's easy to happen. It might be things in the family, it might be bullying at school. There are all sorts of events and circumstances, aren't there, that can, dent people's self-esteem and self-confidence. And then feed into sort of people's sense of their selves, their identity. You made me think of what you were saying about the Reconnect Club that you set up, and how when you got people together, they were able to help each other. Absolutely. And so I think what's so important is supportive communities, but also communities where people can support each other, can do something valuable, can feel that they are making a contribution. They're not just taking, but actually they're giving to other people. So I think that sort of communal situation where people can support each other is really important.
So I agree that connection and community is really important, but it's also quite hard to find in this day and age. So if anyone is listening to this thinking that resonates or that sounds like me, the Hub of Hope is an amazing website. I'll share a link to it. you can go on there and type your postcode, and it will tell you what mental health support is available in your area. It includes charities, it includes NHS, and it includes private support. So if you think you need to find community, get on the Hub of Hope, type your postcode in, and go and try some of this stuff. And I've got a podcast with the Hub of Hope founder, Jake Mills, which will be coming up, and we talk about how you can go about that. So I'd really recommend that. And I know that there's not one quick solution to this. If we accept that people need to find community as well. It's a really difficult question. So I'm going to ask you for like a top 3. What 3 things could a person do if they are listening to this and thinking, yeah, okay, I'm feeling depressed and it might not be a chemical imbalance? What could those people do?
I mean, identify what it is. What are their feelings saying to them? What's wrong in their life? What needs to change? What can they change? And that might be about changing their relationships, finding new relationships, repairing old relationships. It might be about changing work, or it might be about finding new interests or some sort of new direction in life.
I really like that. Like number 1 of the, I don't know, I don't like top 3s, but we could be here all day. So number 1, I really like that, is identify what might be going on. And it could be really practical. It could be you're in a housing situation that maybe you have some ability to change. And that might be, so what practical or emotional things might be leading you to feel this way. Yeah. What else can people do?
Yeah.
It could be a group.
Yes.
It could be your church. Yeah. All sorts of different possibilities. Yeah.
And there are some amazing groups out there. You'll find them through the Hub of Hope. But yeah, there are some amazing ones out there.
Yes.
I'd like to add the 3rd.
Yeah.
I'd like to try and feel the emotion. I think from my experience, I've always pushed it down, and it's quite a hard thing to do. And I think perhaps that might be the 3rd, because you probably do need a safe space. You do need a connected community.
I think trying to be with our emotions is important, isn't it? I think we've got a tendency in today's society to try and get rid of them however we can. And I think learning to tolerate them and feel them, and as I say, understand what they're telling us, can be helpful. But sometimes that's really difficult for people, and they need to have set up some sort of support system first.
Yeah, I think that's really, really important. And one quick way actually to possibly change how you relate to your emotions is I don't personally like the view of good and bad emotions. I think all emotions serve a purpose. And I'm quite wary of good and bad emotions. You know, don't feel the bad ones. You've only got to feel the good ones. And I think as a society, we do really push that.
And I think another thing I think to think about depression is that for the vast majority of people, it will pass. I think that's another really important lesson. It might come back again, moods go up and down, but normally the mood you're in at the moment will lift eventually.
Yes.
And sometimes it is just about sitting it out until things are a bit better, and then you might have a better chance to look at your life and try and work out what's happened and what you can change.
It might pass, but it'd be really difficult if you're doing it alone. That's why I think if you can find community and find connection and talk to people.
Yes, absolutely. I suppose what I'm wary about is people who go from one drug to another, or then sometimes end up having ECT or on ketamine or other sorts of interventions, chasing, it seems to me, a fix that isn't really out there. And I think that just compounds how people feel, because the fix isn't out there. They will inevitably feel, or probably feel bad again. Then they'll blame themselves, as you were suggesting you did.
As you say, it was awful. It was so hard. The hardest thing I've ever been through. I wouldn't wish it on anyone, but it is definitely, I've come out the other side out the other side is the wrong terminology to use. My experience of depression have certainly made me grow. If anyone's listening to this, and it can almost sometimes be like, talk about depression as a growth experience can almost be controversial to some people. What would you say to anyone that would listen to this and say, well, you're downplaying depression?
I don't think they're contradictory. I don't think just because something positive can come out of depression doesn't mean that we're saying that it's not significant or not really bad when you have it. I know people who've had really, really severe depression and still managed to turn their lives around and to use that experience to really do some good in the world. Yeah. As you are, Joe.
Oh, thank you. I think it's that you go on Instagram or you watch the news or TikTok or Facebook or whatever your social media, or we all hear celebrities talking about depression in a very different way to how we've just had a conversation about it. And it's just a different message in the media. Why do you think it's taking so long to change?
Money, professional issues, vested interests, yes.
As well.
And then added to that, there is this idea around that it's a kind thing to do to tell people that they've got a medical problem, that there's something wrong with their brain, which is, I think, for many people coming from a good place, even though, as I say, I believe it's misplaced and actually not a kind thing to do in the long run.
What advice would you offer to anyone listening or watching this podcast that feels really challenged or threatened by this message?
I would say to talk it over with a friend or a member of your family. If you're taking medication and it's making you question whether you should be on medication, have a good think about the pros and cons of medication. Read up about it as much as you can. And then if you decide you want to try and come off the medication, go and get professional support with that. Do it carefully, do it slowly. Don't just throw your medication down the toilet. And make sure that you have good social support while you're doing that, if that's your decision. But I think just, take a step back and take time to think it over and talk it over with people would be my main message. Yeah.
How can people find more about your work?
I've got a website, Joanna Moncrieff, at wordpress.com or something like that.
I'll put a link.
Can I just mention that I've got a book coming out, maybe?
Yes, please. Tell us more.
So I've got a book out called Chemically Imbalanced. It will be about our publication of the paper on serotonin and depression and the reaction, and also a bit about alternative ways to think about depression and to support people.
Brilliant. Yeah. Thank you so much.
Before we go on to wrap this up, I want to be really, really clear that we're not suggesting that anyone should stop taking antidepressants. As you've heard, they're serious drugs, and whilst it's important we're informed, it's equally as important that we don't make any changes without the support of a doctor. Right, you've stayed to the end now, so you're basically part of our community, and I need your help. I've paid for the whole of season 1 myself, and I'm running on fumes. I'm trying to raise £1,200 to cover the cost of season 2. Every penny will go towards creating episodes that help people who are feeling lost and alone. If you found this episode helpful and you're able to chip in, then please do help us to help others. You can donate towards season 2 by heading to my Ko-fi page, which you can find in the show notes. Also, if you're in London and you want to join our Reconnect waiting list, go to reconnect.club, or if you'd like to speak at your organisation, it's joetudor.com. Thank you for your help in growing the Reconnect community. Until next time, see ya.